Good afternoon, good evening, maybe even good morning. Welcome to the Galt Center and Georgetown Juvenile Justice Clinic and Initiative's 9th session of our 2022 Racial Justice Training Series, in which we're going chapter by chapter through the extraordinary work of Professor Chris Henning's book, Rage of Innocence: How America Criminalizes Black Youth. In our past sessions, youth defenders, advocates, scholars, young people have been engaged in discussions with Professor Henning about the content of each chapter in her book. In these sessions, we explore the content and we lift up the narrative, the history, the research, and dig in through conversations with our panelists to use that content in our work as advocates and defenders of young people. Last month, we had a powerful discussion on the chapter Policing by Proxy. We talked about how America has an obsession with vigilantism, demonizing Black children, and oppressing Black communities. We also talked about apps like Nextdoor and how they're used in concert with police to oppress Black, Latino, Latina, Indigenous, and other youth. Today, we're going to focus on policing by trauma. In the introduction of our panelists today, I'm going to give a brief summary of their bios. I'm going to see a more thorough bio that gets put in the chat. And after I give the brief synopsis, I'm going to ask each of our panelists to talk with us in 60 seconds or less about why this topic, policing as trauma, is important to them and the work that we do. We're so excited to be joined today by Dr. Juan Del Toro, Joe Houston, and Dr. Tiffani Johnson. Chris Henning is going to be our moderator today. She's going to explore with each of them their expertise and experience and bring to life the work in her chapter. So we're going to start off, of course, with the author of our book, Professor Chris Henning. Chris, as I hope by now you all know and love, is a professor of law and director of the Georgetown Juvenile Justice Clinic and Initiative. Chris has represented young people in DC courts for over 3 decades, which is amazing. She continues her scholarly research and writing that we in the defense community have been able to use in our advocacy for young people. We're so grateful to her for all of her scholarship, leadership, and work. And we're really interested, Chris, to hear from you today about your experience and why policing as trauma is so important to you in the work that you do. In 60 seconds or less.
Got it. Sorry about that. So look, Marianne, I have seen it in my practice and my advocacy time and time again, representing children. When folks talk about a police stop or a police frisk, we hear police officers, policymakers, legislators often will say, well, he was only stopped for 3 to 4 minutes and the officer didn't lay hands on him and he was allowed to go about his way. People simply do not understand the impact of policing on Black and brown youth.
Thank you so much, Chris. We're so excited to be joined today by Dr. Juan Del Toro. We know a number of our advocates and community members have been using your research, Dr. Del Toro, in their work. Dr. Del Toro is an assistant professor at the Department of Psychology at the University of Minnesota Twin Cities. He also holds a research associate affiliation with the Learning, Research, and Development Center at the University of Pittsburgh. Dr. Del Toro is an applied developmental psychologist, which means that we get to use his work. He examines how ethnic, racial discrimination, identity, and socialization shape human development across the life course from childhood to adulthood. Through his research, he seeks to leverage opportunities to reduce the harmful effects of ethnic racial discrimination and unwarranted involvement in the criminal justice system on children's well-being. He is a researcher for us, and we are so excited to have him here with us. He's authored a number of original publications that we use throughout our work, and we're so happy to have you here with us. Dr. Del Toro, can you tell us from your perspective, why is this topic, policing as trauma, so important to you?
Yeah, for me, growing up in the US, me and my family are immigrants, and we grew up in a very low-income neighborhood. And growing up in a predominantly Latino and Black neighborhood, I've noticed how, just by sharing that I'm from Richmond, California, I was often asked, do you feel safe in that neighborhood? And of course I felt safe. I was just, my community was just very much stereotyped. And I kind of asked a lot of questions back then about how those perceptions could affect them in their day-to-day lives. So some of this research has been research, and it has been fulfilling to perform this research a lot.
I have not heard research. I love that. I love that. And actually, interestingly, I think all of the panelists today have come to their work through life experiences. Thank you so much, Dr. Del Toro. Next panelist I'd like to introduce is Joe Houston, also known as JoJo or Mr. WeFit. Joe is a DC native, he's an entrepreneur, and he's a personal trainer. He came home from prison when he was 21 years old, and after trying out a few different careers, he landed on his work as a certified personal trainer. From Joe's personal experiences, including the loss of his own mother, Joe understands the importance of health and understands how people of color can suffer from health disparities. He wants to have a bigger impact on his community, so he started a 501c3 nonprofit, training and helping others become certified personal trainers. Through WeFit DC, he goes into hard-hit DC communities with a team of trainers and nutritionists, and he offers free personal fitness programs. He now has government contracts, private partnerships, and was featured in Men's Health magazine. And in Joe's own words, he doesn't look at WeFit as a job, it's an opportunity to give back to his community and help empower people to make an impact. Thank you so much for being with us. Joe, in your words and experience, why is this topic, policing as trauma, so important to you?
Thank you, Marianne, for the introduction. I'm just so excited to be a part of this panel. This is a big topic right here, policing trauma. A lot of people don't talk about this, so I'm just so excited to be bringing up this issue. Personally, for me, just growing up and, just being afraid, just to hear that, just to see officers sometimes and just reactions and just kids. So just growing up, understanding that it can be life or death that quick. And sometimes you could just be not doing nothing wrong. So I think this is a huge topic, a very important topic that we don't talk about a lot. So I'm just excited, very excited. You can see how passionate I am to just be talking about this. So I'm very excited to go dive in about policing trauma.
Thank you so much, Joe. And thank you so much for bringing it right to the impact on health and well-being of young people, which turns us, of course, to our next panelist, Dr. Tiffani Johnson. Thank you so much for being with us. We're also incredibly excited to have you with us. The more we learn about Dr. Johnson, the more we know she's going to be part of our community and help us in our work moving forward. Dr. Johnson's a tenured associate professor of medicine and a board certified pediatric emergency medical physician at the UC Davis Children's Hospital. Dr. Johnson's research has focused on race and racism and its impact on child health. She's currently exploring the root causes of inequities in the healthcare and early childhood education systems, and her research on bias and discrimination and its impact on health and well-being of children, we know is going to be useful to everything that we do. Very wonderfully, Dr. Johnson is a daughter of a public defender from Newark, New Jersey. And Dr. Johnson saw firsthand her mom advocating for her clients' rights. And now as an ER doctor, Dr. Johnson sees on every single shift how she needs to support the rights of her patients over law enforcement actions, even in the ER room. Dr. Johnson, thank you so much for being with us. We'd love to hear from you in 60 seconds about why this topic, policing as trauma, is so important to you.
Thank you so much for having me. I am just as excited as the other panelists to be here engaging in this discussion today. So at the heart of the matter, I'm a pediatrician. And as a pediatrician, I really care about the health and well-being of children. And I like to think about health as not just the absence of disease, but how do you support children to achieve their highest potential. And in pediatrics, we focus a lot on what some of those social determinants are that impact health. So traditionally, we think of social determinants as where children live, where you learn, where you work, where you play, but I also include how their rights are executed. And so these are things that can impact children early on that affect them across their entire life course. So as someone, I believe any pediatrician that supports children and cares about children's health and well-being, we need to be aware of these issues and figure out how we can partner with law and the justice system on helping to support youth.
Thank you so much. And so from that, I'm going to kick it over to our expert moderator, leader, Chris Henning, to bring us through this conversation. We are so thankful to all of you for this conversation today.
All right. Thank you so much, Marianne. It is such an incredible honor to, for many years, to just be in partnership with the Galt Center around these incredibly important issues, and especially our unique focus on racial justice. I am very excited to have this conversation. Excited might not be the right word, right? Pained to have this important conversation, but I'm glad you all are with me. As Marianne said, today we're going to talk about chapter 9 of the book. And I have to tell you, chapter 9, Policing as Trauma, is one of the most important chapters in the Rage of Innocence. When I set out to write this book, one of the central questions that I wanted to answer was, how does policing impact Black youth mentally, physically, developmentally, and psychologically? And this chapter focuses specifically on that question. But as those of you who have been with us through this webinar series know, we really want to bring this conversation, all of these conversations, to life with real children who have been impacted. And so I start chapter 9 with a story about a client I call Kevin. Kevin was a client that I represented for about 3 years in Washington, D.C., along with my law students at Georgetown. One day, we got a call from Kevin asking if there was a warrant out for his arrest. And we thought it was a very odd question because we had just been in court with him the day before. If there had been a warrant, he would have been taken into custody right there. We could also hear his mother in the background yelling, "Boy, you're just being paranoid. They aren't out there for you." Well, it turns out what she was saying was, and what Kevin was worried about was that Kevin had been sitting in the window of his home, and he looked out of his apartment building and he could see a police car that had been parked out there for 2 hours. And so Kevin was convinced that the police officers were out there waiting for him. And so many people who hear this story automatically think, well, if Kevin hadn't been doing anything wrong, he wouldn't be worried about the police. But what most people don't realize is that, or what most people don't encounter the police in the ways that Kevin does, and as often as Kevin does. So Kevin, by the time he was 17 years old, had been stopped at least 50 times. And I have to tell you, most often he was stopped for not doing anything wrong at all. Walking into a convenience store, coming out of a convenience store, standing with friends after school, sitting on a folding chair with friends and family in front of his apartment building. And so I realized in hearing what Kevin was pondering, what he was worried about, I realized that Kevin wasn't being paranoid at all. Kevin was just traumatized. He was traumatized by this lifetime of encounters with the police. And so, as we know, Kevin is just not alone. Really, Kevin is just not alone. And I think, Joe, just even your opening remarks talking about growing up living in DC, I know that Kevin is not alone in having these types of reactions to the police. And he's not the only young person with a story like this. So I want to start with you, Joe, not only because you've grown up in DC, but also because you work with young people. And so how have you heard young people in DC or elsewhere describe their emotions, their fears, and their reactions to the police? And if you're willing, how would you describe your own experiences or feelings, I should say, about the police?
Absolutely. When I was reading that first little paragraph right there, like I felt that because I can relate to Kevin in that situation. I can recall personally for me, when I was probably about 14, I was 14, about to be 15. I was on my way leaving, coming home from Ballou. And soon I got off the bus and I was walking in my parking lot. I seen a police officer on my front porch talking to my father. And it was just red flag. I ended up going up the street around the corner. And the whole time I called my stepmom, my father's wife, and was like, hey, is they there for me? And I didn't do nothing wrong, but I thought they was there for me. So I was like, wow. And the whole time my mom, my stepmom, she be cooking and stuff like that. And she asked, the officer was coming in there just to do like a security check. And she asked him, did he want something to eat or something like that? So I was just like, really like, that's trauma right there. Just being paranoid, thinking, hey, is they coming there for me? Did I do anything wrong? So I can really relate to what Kevin went through at that.
Absolutely. Joe, and it's like, I have
Just
so
different
many
things.
clients.
Yes.
Yeah, sorry. Yeah.
Same story.
Yeah, same story. That's exactly right. So many clients who have experienced that. So many clients who talk about, coming home from work or coming home from school, getting, turning the corner, and they could see the front door to their house and a police officer is in the vicinity, and they would rather turn around, pivot, and go the other direction than to have to walk past. And so we'll continue to unpack that. I want to turn to, Dr. Del Toro and Dr. Johnson, and I want to tell the audience, both of them have given me permission to call them by their first name. So we'll be talking to Juan and Tiffani in this conversation, as well as Joe. And so we're going to talk about the empirical research in a minute, but again, to make sure we keep the focus on real people and real children and not just on data and research, we want to just continue with the stories just for another moment, right? To center the experiences of young people in this conversation. So I want to ask both of you, what, central, can you think of a central story or an anecdotal piece of evidence that you've heard from young people and families of color who have come in contact with the police, either directly or vicariously? How have you heard them describe their fears and emotions and reactions? And so I'll start with you, Juan.
Yeah, so I'm just going to read one quote from Dr. Rob Brunson, who's a criminologist at Northeastern University. And in one of his qualitative papers, a young Black boy says, 2 blocks from me, it's like a little heroin area. The police is really hot on this area now. One day I was walking from over there and the police seen me standing over there. I mean, they know I don't sell dope. They know I go to school every day. Everybody don't gotta be the same thing. This is what I try to explain to them. Just because I'm out here don't mean I sell dope, man. I mean, every time you check me, I'm clean. I mean, I don't even carry money no more. How am I selling dope and I don't have no money in my pocket? Check my shoes, make me take off my socks. Man, it's cold outside. Pull down your pants, says the officer. All types of stuff, man, and it's freezing outside. Make you lay down on the ground. To me, that's police brutality. And so a lot of these experiences are very, very common among a lot of young boys and women.
Wow. Yeah, it's a powerful quote. And I so thank you for elevating Rod Brunson's work. He was definitely one of the early researchers I looked in when I, was finding research, not just for the book, but even before then. He does some great qualitative research in Cincinnati, lifting up the voices of Black and Latino youth in the city. And so very powerful example. Kids are very clear about how they experience and perceive policing in their neighborhoods. And it's cold, it's freezing outside, and you got me laying down in the ground. Powerful. Tiffani.
I'll just add to that although most of my work is focused on anti-Black racism, we know that these are issues that affect all minoritized and marginalized youth. And so I was recently at a conference for the American Academy of Pediatrics, and one of my pediatric colleagues shared an example of a young Latina in her practice who was having syncopal episodes where she was passing out in the morning before going to school. And so she had been to the emergency department, she had been seen by cardiology, she'd been seen by neurology, and really got the $1 million workup in the healthcare system to kind of try to identify what was causing these symptoms. And, everything kind of came out clean from her labs and all, her echo, EKGs, all the evaluation. And what they were able to get down to with further discussion was that her father and mother were undocumented. And she had been kind of seeing things in the news. And she was really afraid that when her father dropped her off at school in the morning, that ICE was going to detain her father and kind of separate the father from the family. And so that's just another example of how that fear can definitely present and manifest with physical symptoms in terms of the trauma that youth are experiencing.
Hugely important. We are going to dive into each of those, the psychological trauma, how the psychological trauma leads to physiological responses, leads to poor physical health outcomes. We're going to try to talk about, different racial and ethnic groups and how they're impacted. So it's a perfect example, Tiffani, to really make that real for us. I do want to ask the audience also, for those of you who have been in these webinars before, that we try to engage with you through the chat feature. And one of the things I would love for you all to put in the chat is examples that you have heard of young people that you've worked with, that you've spoken to, whether it's school, in your practice as a lawyer, as a healthcare professional. Just, one example of an experience like what we've talked about. How does a child, and especially a child of color, respond to the police? Just so that we could really share those stories. So if you'll put those in the chat, we would be grateful. So, to press us forward, given the stories that we just shared here, we can confirm, we know that what Kevin's mother, my client Kevin's mother, describes as paranoia is not unique or isolated to Kevin. We also know, at least I don't think that Kevin's fears are at all unreasonable, given the data on the disproportionate contact that Black, Latino, and other minority youth have with the police. And so we've been talking about those disparities for the last 8 months, in this particular webinar series. And that data tells us that despite dramatic declines in arrest and detention rates among youth generally since the 1990s, racial disparities in policing and incarceration of youth persist. And in many instances, have even worsened. They've grown broader. The disparities are greater even than we used to. Just to say a word about African-American youth, in 2020, data from the Office of Juvenile Justice and Delinquency Prevention showed that Black youth are arrested at over 2 times the rate of white youth. In 2022, the Sentencing Project issued a report noting that Latino and Latina youth were the most likely ethnic group to be detained upon arrest and before or pending some sort of disposition. And they were followed by African-American youth. So Latina youth more likely to be detained, followed in second order by Black youth. So, we've spent a lot of time in the last 8 months focusing on Black and Latina youth, mostly because that's the data that we have. Right? The studies that we look at focus on those two populations, and we just don't have enough quantitative data on all of the nation's different racial and ethnic groups to give us a complete picture of the disparities in the criminal legal system and the juvenile legal system. But we've been trying to gather that data. And fortunately, we have with us, Juan Del Toro today, who, like us, has been looking into some data on indigenous youth or Native American youth. And so I want, Juan has offered to share some of the data that we have been finding in that category. So I'd love for you to share, Juan.
Sorry about that. I forgot to unmute myself. And absolutely, in a 2021 report from the Prison Police Initiative, youth identified as Native American were incarcerated at a rate second only to that of Black children, and were incarcerated at a higher rate than white, Hispanic, and Asian youth incarcerated combined.
Yeah. That's right. And so we're slowly gathering that data together. And also, so you're looking at national data. You've shared with us some national data, Juan. We also at the state level have found sometimes even greater disparities than at the national level. So think about states with a high percentage of indigenous youth or Native American youth, and you see that as well. And then thinking about another category where we really need more data, thinking about Asian American youth, or more specifically, in certain parts of California, communities with larger concentrations of Pacific Islanders and Southeast Asian youth have seen disparities in police stops, questioning, arrest, and detention. Now, I will say that the California data, much of the California data that we were able to find is about 20 years old. But at times, we have seen in California that Cambodian youth, Chinese youth, Laotian youth, Samoan youth, and Vietnamese youth have had high rates of arrest and incarceration. And also the data has shown that Southeast Asian boys and young men have been overrepresented in gang databases. So we're looking, and what I would say to you all is on the Zoom is if you find that data, one, share if you know, even in the chat right now, so we can collect it, but we urge you to email us at the Georgetown Juvenile Justice Clinic, at the Galt Center, and I'll put my email in the chat. Folks, share with us some of that data that we're looking at, because although my book is The Rage of Innocence, How America Criminalizes Black Youth, what we have seen consistently nationally and across states is racial disparities in other ethnic groups. So thank you for that, Juan. We really appreciate that. All right. So let's dive in. Let's talk about some more about this trauma, what trauma means, and how it shows up in some of that empirical research. So let's assume for the moment, right, that Kevin is not unreasonably paranoid, right? I then, if that's the case, really want to understand his reactions from a psychological lens, right, from a psychological framework. And so I'm going to turn back to you, Juan, and I want to ask you, am I right in my amateur diagnosis of Kevin as suffering from trauma? And so the way I think to start the conversation is, can you define trauma for us?
Absolutely. According to the American Psychological Association, trauma is an emotional response, the emotional response to a terrible event, especially a negative adverse event, including an intrusive police encounter. And absolutely, you're absolutely right in your, diagnoses. You can hear his response in being paranoid and also fearful.
Mm-hmm. Fearful, right, exactly. And so this notion of what constitutes a negative encounter, and you include policing in that, and we will dive more, but there's so many ways. I mean, you could say just a word about that. All the, the variety of ways in which policing can be perceived as a negative encounter.
Yeah. Oh, what would you like me to describe it?
Yes.
Yeah, absolutely. Examples include, stop and frisks, use of racial slurs, threats or even uses of physical force. And that's some of the very explicit types. There's also more subtle types like surveillance, just being followed by on the street constantly. Yes,
that range is huge, right? It's the police killings all the way to just the surveillance and the perception of surveillance. And I keep using that word perception, as we've seen in other webinars. It's not, even the officer who intends to do a wellness check, as Joe said, right? His example was perfect. Somebody coming, do you guys need anything? It can be a traumatic event. And that's what we're trying to teach and educate folks on at that level. So Tiffani, let me turn to you. And you also, I mean, your example of the young person who was worried about whether or not ICE was going to come is such a perfect example of the the long-term or even the immediate sort of physical and physiological responses that often accompany this sort of psychological trauma. And I think about like Kevin having a very early, vivid memories of his first contacts with the police. And these kinds of experiences are cumulative over time, right? And so we'll talk about sort of the cumulative impact, but can you give us like a preview or introduction of some of the sort of long-term medical consequences that can accompany the types of traumas that we're talking about?
Absolutely. So in the pediatric patient population, we talk a lot about ACEs, or adverse childhood experiences, which hopefully this audience is also familiar with because it impacts your clients who you are helping to defend in the justice system. But it's important to recognize that those ACEs were initially developed and validated in the Kaiser healthcare system out here in California. So they were predominantly white men who were middle class and insured. But ACEs include things like whether you experienced or witnessed violence in your household, child abuse, neglect, if divorce of your parents, substance abuse within your household. And what we know about ACEs is that they have a long-term effect on outcomes. So from a behavioral health standpoint, it includes things like current smoking as well as heavy drinking. And we also know that many of the leading causes of death in adult populations can be linked with ACEs. So things like diabetes, cancer, coronary heart disease, strokes, kidney disease, asthma, and depression are all linked with adverse childhood experiences. And again, as we think about those social determinants, they also result in social economic challenges like increased unemployment, not graduating high school, and having no health insurance. And there's a growing recognition that beyond those initially validated races and those adverse childhood experiences, there are also adverse childhood environments. And so a recognition that experiences of racism and discrimination in your community as an ACE, as well as violence in your community. And so we would characterize that the police trauma kind of crosses both of those because they're directly related to racism, but also they can oftentimes be violent. And so thinking about ACEs and the way that they impact it, but also just thinking about experiencing racism and discrimination in general. So racism can occur at multiple different levels. So you can have kind of personally mediated racism. So that's kind of between one person and another, or you can have structural level racism. So thinking about like policies and procedures that disproportionately marginalize different groups based on their race and ethnicity. And then youth of color who experience that personally mediated racism as well as that structural racism can then internalize those messages and have internalized racism. And what we know from the data is that individuals who report experiencing racism and discrimination, it impacts pretty much every domain of health and wellness that you can think of. So from a behavioral and emotional standpoint, they're more likely to experience anxiety, depression, and poor sleep. From a cardiovascular standpoint, they're more likely to have high blood pressure or heart attacks when they get older. From an endocrine standpoint, they have higher body mass indexes, obesity, diabetes, and increased waist circumference. It impacts our immune systems with dysregulation of our immune response or our ability to fight against infections when we're exposed to them, or increased inflammatory responses. And what's also really interesting to me is that it impacts epigenetics. So individuals who experience racism and discrimination, it impacts them at the level of their DNA, where you can have methylation of your DNA and shortening of your telomeres that results in kind of premature aging. But then that those epigenetic changes then get passed on to the next generation. So when you have a mother who's experienced racism, those children who are born already start off not at a level playing field because it's embedded in their genetics from these experiences that their parents have had.
So that's a lot. We could have like a webinar just on that. That is very rich, and we've touched on epigenetics in previous conversations and previous webinars. But what I really wanted to pull out is what you've done for us is the ways in which race intersects with all of this, right? The ways in which race intersects with trauma, and the ways in which race drives, I think, police encounters. And so I love how you started us with adverse childhood experiences. Race And racism in all of its form increases the likelihood that a child will experience one or more of the traditional ACEs. But then in addition to that, this notion of racism actually exists in its own entity, as its own phenomena, as an adverse circumstance, an adverse environment, right? That you talked about. So they work together, and that policing intersects with both of those, with all of that, right? And that we have to understand policing as either real or perceived racism, I should say, right? Is a fair assessment of that.
Absolutely. I also just want to uplift a comment, one of the comments from Dallas Martinez, in that we're focusing today on race, but it is definitely important to think about that intersectional approach and knowing that youth who are marginalized based on other identities, whether it's LGBTQ+, whether it's disability, whether it's gender, whether it's based on their social economic status, the intersection of those identities with race and ethnicity makes them even more vulnerable and even more marginalized, and often have even more harm at the hands of police. So thank you to Dallas Martinez for uplifting.
Absolutely. So incredibly true. Thank you, Dallas, for that. All right. So let's, talk about then how some of these fears of the police materialize so early for Black, Latino, and other marginalized youth, right? And so I want to turn to you, Joe, and I think about Black families having experienced police brutality and unfair treatment for decades, right? In our country, right? And in many ways, it's the very foundation of our country, that maybe they weren't wearing a blue uniform, right? But policing has operated since our inception. But it seems like Black children learn to fear the police almost from birth. And so I want to ask Joe whether you remember the first person who talked to you about the police and how to navigate police in your community. Did your parents or relatives or grandparents, uncles, mentors give you the talk, right? Do you remember what was said, and what do you think your family was hoping to achieve with that talk?
Yeah, this is definitely deep. I never in my life until this moment, like, ever thought about that and just how critical this moment was. Like, but I was raised, to be honest, by my sister and my brother-in-law, and it was never, the conversation was never intentional. It was just like, I might see my brother, because we live in the Southeast in a very hard, underserved area, and I might see him run to the door and look to the peephole and like, man, look, the police out there. And it just, seeing that, it might put fear in me that the police is in the hallway and something is about to go down. But it's just like, hey, yeah, be careful, the police, y'all want to make sure y'all go to jail. Like, it wasn't like an intentional conversation, like, hey, sit down, we need to talk. But it was just like them different moments of them explaining about, hey, don't go to jail, watch out from the police, make sure y'all not stealing from the store, the police gonna lock you up, hurry up, come on, before the police get here. Them, a calculation of all them different things, it like put somewhat of like anxiety, paranoia, different forms of trauma. And it's not intentional, like, I know they wasn't trying to hurt me, or because they didn't know better, but it's like a pro and a con, because you want to have that conversation, letting them know how it can be, what, the police can be violent, or you can go to jail, get on trouble, but you also just, it's a good and a bad.
Wow, that's so powerful. I love what you just said, this idea that, like, it doesn't even have to be intentional. It's, we soak it in from what we see and what we hear, people around us, people who raise us, people who influence us, what we see them doing and what we hear them saying. That is so powerful. And it recalls to mind the research, that the developmental research that talks about how adolescence is the time when our views about law and law enforcement become fixed in our minds. And so what we hear our teachers and our siblings, our friends saying is powerful. And you just, you're having that recollection of, they run to the window, the police are outside, and the way you see them viscerally reacting to that had a powerful impact on you. It's so good. Juan, I want to ask you, and Tiffani, really, I got to tell you, when people read or hear me talking about my book, I cover some of this in chapter 5. We've already talked about this in a previous month, but I often get asked whether or not the talk itself is itself traumatizing for young people, or whether it's a good idea, right? Like whether there's some debate about whether or not parents and relatives should give the talk at all. So what do you say to Black parents and other parents of color who feel the need to give the talk?
Yeah, those conversations are very important to have. And there's two things I definitely want to highlight about those conversations. One is that they have to happen early. Oftentimes as parents, we think maybe we don't want to bring this to their awareness too early, but oftentimes by then they already have experienced some form of contact with the police, either directly or vicariously. So it's important to have those conversations early. And second, it's important to, not just bring this into awareness, but also to help them develop effective coping strategies. Because oftentimes being aware could be traumatizing, but if we kind of give them the tools to be resilient when these things happen and provide that space that like we're aware that this is going to happen, come to us when it does. So leaving that conversation open for them to trust, if I share this with my parent, they won't victim blame me. So it's important to also have that conversation and learning how to develop resilience.
I love that. Cultivating resilience in young people, coping skills, because you got to have the conversation and you got to have it early. I really like that. Tiffani, did you want to add anything to that?
Sure. I look at the talk around policing as similar to the talk about sex, right? It's something that's uncomfortable. It's something that parents don't necessarily want to have. But the reality is that kids are getting information about sex from their peers, from the media, from social media. And you want to make sure that they're going to have accurate information so that they can make safe and healthy choices. And I think the same is true for policing. Whether you talk to your kids about it or not, they're seeing it on the news, they're seeing it in television, they're seeing it on social media, they're talking to their peers and their friends about it. So it is our job to make sure that they have accurate information. In pediatrics, we talk about something called anticipatory guidance, right? And so it's like, how do we anticipate some of the social and developmental needs that children and families are going to have and give them the information necessarily to be able to address them? And so I believe that having the talk around policing is an important part of anticipatory guidance. And so the important messages as a pediatrician are, one, how do you make sure that youth know what their legal rights are with police? Some of the comments that were being uplifted earlier were, we hear, and when everyone watches Law and Order SVU, right, we always know like, oh, you have the right to remain silent. But when there is that power dynamic between a child or an adolescent and the police, those rights go out the window when there's fear. So making sure that you're preparing them ahead of those situations of what their rights are if they have encounters with police. The other thing that's really important, because a lot of times youth, when they're afraid, even when they haven't done anything wrong, there's also been lots of discussion of like, when you see the police, you run, right? And we've also seen many encounters of youth who run from the police, and then there's a presumption of guilt and they get shot in the back while they're running for police. So the next important message is that they need to get home safely, and providing them with strategies for how to have those interactions while getting home safely. And then also letting them know that we recognize that it's not fair. And so having these discussions that injustices exist. And you can have those discussions in a nuanced way where you don't just promote distrust for every law enforcement officer. You don't just promote distrust for everyone who doesn't look like you, but ground it in the reality of this is the environment that we live in. This, we've reviewed the data that shows that this disproportionality exists, and how do you prepare them so that they can get home safely?
That's absolutely right. I talk about that all the time, this idea of preparing our children early enough for those inevitable moments of discrimination or policing, whatever it is that we need to prepare them without over preparing them, such that they walk about life afraid of police, afraid of everything. And so all of what you talk about, this idea of coping skills that Juan talk about, knowing your legal rights, all of that is critically important. And some sense of pride, right? Some sense of race pride becomes a buffer. This idea that we know it's not right, and that you are entitled and, to be and exist and to live as a, successful and productive Black child or brown child to go about free in society. But the reality is we live in an unjust world. So I love
that pride is important. So we like this concept is all around like racial socialization, right? And so how do parents talk to their children around issues of race? And the most effective strategy for racial socialization that has been shown to buffer against the negative consequences of racism is cultural pride reinforcement. So we need to prepare them for the negative things, but also that balance of cultural pride. So when it comes to law enforcement, that may be like highlighting examples of famous African Americans and Latinos who are involved in the justice system who have been able to advocate. So there's not just this sense of you can't trust anybody who's in the justice system, but balancing it with some cultural pride for those positive examples that are there as well. And the other important point is that I don't think these are discussions that just need to happen with Black and brown kids, right? Because Black and brown kids sometimes have friends who are not Black and brown. And so it's important that white families are having these discussions as well. I'll give the example of I have a friend who has a Black teenage son who has a white teenage girlfriend. And around some of this kind of social justice outrage that's been happening recently, she had F12 on the back of her car. And so my friend had to have a discussion with her and her family of, all right, my Black son is riding around in his car with you, right? And what are some of those potential consequences? So these are discussions that need to happen with children, adolescents of all races and ethnicities as we're addressing issues.
I love that comment. Thank you so much. I think that's so true, Tiffani. So true. All right. So, look, so clearly from our conversation, it's clear that part of the fear that young people have of the police arises from these stories that are passed on, right? The talk or other verbal accounts, right? Or just observations like Joe talked about, observing people in your family act a certain way in response to the police. But Dr. Johnson or Tiffani, you write in your article, you have a wonderful article called Executions and Police Conflicts Involving Children, Adolescents, and Young Adults. And you write about how the traumatic effects of policing are not limited to executions, right? So we've talked about in this series, the death of Tamir Rice and Mike Brown and just far too many others, but they also, right, these fears of the police also arise out of other sort of harmful interactions, right? Other unnecessary, whether it's excessive or otherwise, the fact that it's unnecessary use of force. And so we want to make sure that we, are clear that we're not just talking about those high profile homicides. And I think we've already heard some examples from Joe, from Juan, but I want to make sure that we lift up your article. And if there's any, so the other way to help us understand the breadth of police context that might lead to some of this trauma.
There are so many ways in which youth of color in this country are over-policed and underprotected. And so I think that Juan highlighted this a little bit. So it may be that over-surveillance in your community that's included. And he uplifted some examples of, the example of a quote. There have been other studies looking at kind of the social, the psychosocial impacts, and youth have reported experiences where the police will pick them up and then take them to another neighborhood that is an unsafe neighborhood as a threat tactic. There is verbal abuse. There's also lots of data that shows that in addition to police shootings, there are also other uses of excessive force, including disproportionate use of tasers, as well as even police dogs, where both adults, adolescents, and children are more likely to sustain harm from encounters with police dogs in cases that are often nonviolent that involve the police. So the breadth and depth of the ways in which law enforcement involvement is really important. And to know that it's not just happening in their communities, but it's also happening in their schools. And so there were some comments in the chat box about children who are afraid to go to school because of the police presence in school. And there have been lots of kind of high profile cases in the media of youth engaging in developmentally appropriate behavior that when you happen to be Black or brown, it becomes criminalized. And that ranges from preschool and kindergarten, where the police are being called on children for having temper tantrums, which again are developmentally appropriate, to adolescents, having the police called on them and literally having their desks flipped over or dragged out of school for doing things like just talking on their or pulling out their cell phone and texting in class, which is what teenagers do. And so I think that is really important to know, that it doesn't just, they're seeing it in their community, but they're also experiencing it on a regular basis in the education system, in the form of safety officers in the school as well.
Yeah, absolutely. Just the sheer presence of an officer at the front door of your school when you walk in the door, in and of itself, can be experienced as traumatizing, right, for a child. Being asked as simple as, where are you going and where are you coming from when I'm walking down the street, is invasive and can be traumatizing for a young person. Juan, did you want to add anything to that?
Not anything that has already been mentioned.
Yeah, because you gave such a great example earlier, just the being, asked to undress in the cold, right? Lie down in the ground in the cold. What
the other thing that I'll add to that is when it comes to mental health as well, is that we have a lot of youth. Joe talked about there was just kind of like a wellness check, and the need to have alternatives to policing when issues around like mental health and safety come up, because there is, in addition to the data showing that Black and Latino and Indigenous children disproportionately have negative encounters with police, there's also data that if you have mental health involved as well, that really increases the chances of having a negative encounter, which often can lead to death. So there are lots of communities that are working on, instead of calling 911 for the police to show up for a wellness check, what are some other alternatives so that we can kind of keep our children safe?
Yeah, I love that. Alternatives. And before we end today, we will talk about alternatives. And I love that as a practice point, right? Thinking about both in the child welfare system, for example, in the delinquency system, in the mental health system, in drug overdoses, all of these contexts. Why do we rely on the police to help, to provide some mental health intervention or some drug intervention or some wellness check? I love that as a practice point. So let me, what we want to do is to really, really drive home this idea that even I don't even know if I want to call it a well-meaning, but even an encounter that a police officer does not perceive to be in any way hostile becomes terrifying for a young child. So we're going to play a video of a police stop of a teenager in Louisville, Kentucky. All right. And I'm going to tell you now, for those of you who are watching, for me, this is one of the most painful videos to watch. It's not physical violence. It is very much a psychological encounter. I'm telling you now. So we're going to play a couple of minutes at the beginning of the encounter, and then we're going to skip ahead and play you just a minute or two at the back end. And let's just look at how this encounter has a psychological impact on the young person. And I invite you in the chat to write your reactions, type in your reactions as you're watching. All right. And so our wonderful Amy from the Galt Center will play that video for us.
It's going to fall out when you get out of the vehicle.
Why are you taking me out the vehicle?
I'll move it up here for you.
Mama, they taking me out the vehicle.
Don't hop out?
Get out of the car. They telling me to get out the car now.
And that's the reason why I didn't want anything on you. I don't want to break your phone, brother. You don't have any weapons on you, do you?
I don't.
No drugs?
Nope.
Awesome, man. Turn around, put your hands on the car for me. Switch feet.
I even did anything. Why are you checking me for?
I didn't say you did anything. So you don't have any.
Why did you take me out the car?
Do you have any drugs, weapons on you?
I don't. I told you that when you asked me the first time. I do mine.
Okay, awesome. Well, I'm going to make sure you don't have any weapons, okay?
No.
Yeah, we're allowed to pat you down for weapons.
Mama, they pat me down.
Yeah, we're allowed to do that. Quit doing the clenching your fist thing, too.
That's some bullshit.
What's bullcrap?
The only day I got off, I just want to go home. Will you close my door?
No.
Why?
I can't leave you to go close the door.
Okay.
Quit with the attitude. He's not giving you an attitude, and I'm not giving you an attitude.
I understand.
We deal with violent crime all day, every day. We're going to stop 30 more people after you. As soon as we get down here, you'll go home, okay? If you're wasting our time and we're wasting your time, I'm sorry for the small inconvenience. We're allowed to get people out of the car. Your heart is beating through your chest when you're on the phone with your mama and you're narrating to your mom, Mom, I stopped by the police. This is where I'm at. They're getting me out of the car. Oh my gosh. Yeah. When you do all that, it's the same thing that people do when they're trying to hide something from the police and they're trying to take the situation off of it. Just like you're looking back at my partner over and over and over again, like you're waiting for him to see something or for him to do something wrong. It's 2018, young man. We all wear body cameras. It's recording all of it. It records your audio, my audio. It records all that. So guess what happens? If there was something in that vehicle and we go to trial over it, guess what? The jury gets to see your attitude. We're here for you, man. There's a shooting every day. It's crazy. It's sad. It's ridiculous. Ain't nobody been nasty to you at all.
Canine indication at 18:10. Yeah.
Asking, why do you have like this negative view towards the police? What's the deal? What's ever happened in your life personally where you're like, you can give me a good explanation?
Absolutely nothing.
Really?
Fucking I graduated. I got a good ass job.
Right.
I graduated with 3 4 band scholarships. I ain't never did shit in my life. I've been in the house all day.
So what's the problem? Like why are we in this situation?
You?
Huh?
What you mean?
We didn't do it.
You pulled me over?
We made a traffic stop for your violation that you did.
Alright, man. I don't want to talk.
And then you went up here with it. Huh? You did the entire time. We don't know who you are. I don't know that you graduated and you got several scholarships and that you have a good job. I mean, I don't know. It's not like I have a x-ray vision that says, oh, this is who's in this card. He's good to go. If you don't want to hear it, that's fine. You can continue with your negative view towards me, I guess. I just figured I'd try to understand it, but that's fine. Huh? I'll never understand? Well, I don't hold no hard feelings against you. I don't take it personal though, buddy. If I take you out of these handcuffs while he's finishing up, are you gonna fight me or run or anything like that? Because initially when we brought you to the back of the car, you're clenching up your fists like you're gonna fight or punch or run or whatever. And you've been doing this pacing back and forth thing the entire time. I'll go ahead and take you out of cuffs, but I don't want you to like take off running to your car or fight me. Is that cool? I know you're mad. It is what it is, but I'll take you out of them since they're a little uncomfortable. Is that cool? Huh?
You're gonna take me out of them, man.
Is it cool? You gonna be chill?
Yeah, I'm gonna be chill.
All right.
All right, sir, here's your ID back. All right, you've got court October 2nd for improper turning at 7 p.m. 600 West Jeff. Do you understand the reason why you stopped? All righty, have a wonderful day.
So I see already from the comments, someone shared, something that I said also, this idea that this is one of the most painful videos to watch. It is so, as an observer, psychologically traumatizing. Really, it's infuriating. I'm reading some of the comments, right? Wanting to use profanity, Susan, I'm with you, right? Just making the officer making themselves the victim, right? Just nauseating, just the power dynamics, just so much in this. And I will say to you, this is so funny, rewatching this video, it reminds me of what I said in response to Mary Ann's opening question. Why is it that you're so passionate about this? It's videos like this. And the officer said, and I quote, "I'm sorry for this quote unquote small inconvenience. This idea that somehow that is not a small inconvenience. And I think what we've already heard from, our doctors, Dr. Del Toro and Dr. Johnson, this is more than small. So let me turn to Joe and just, do you have any sort of reactions? What does this bring up for you when you watch this?
To be honest, I watched the video like 3 times, and it really hurt. Like, you see at the end of the video, you see how defeated he looked. And this kid, if I know the video is like 17 minutes long, they was disrespecting his mom. He came up there, they didn't read him his rights. They didn't tell the reason, because they so-called, when the sergeant came, I know you guys missed it, when the sergeant came, he said that he told the mom that it was a traffic infraction. But when he told him to get out the car, he didn't give him no reason. He just said, get out the car. He see that he was a kid. He didn't understand law. It was a power dynamic. I seen it in the chat. He used his power, and it was just so unfair for that little boy. He was so smart. He never got in trouble, wasn't never in the juvenile facility, no nothing. And he just looked so defeated when he was getting them court documents. So it really hurt me, being a young man of color, just watching that. So I'm just disgusted. That's how
it's yeah. And it's so hard I'm so with you. And I thank you for bearing with us, Joe, and watching it. Same thing. I had to watch it multiple times. I will say, this idea, I really just wanted to draw out this notion that you said that the officer wouldn't even tell him when he pulled him out of the car why he was pulling him out. We talk at times in this webinar series and elsewhere about procedural justice, right? That in and of itself is just such a violation. Just tell me, explain, help me understand. Not that, first of all, the stop is bad, period. That doesn't justify it, but at least tell me why you thought you stopped me, right? Juan, I wanted to turn to you next. Was there anything, that just resonated as you watch this?
Yeah, and I would say it's a good example of racial bias at its best, because throughout the scene, throughout the 17 minutes, the police officers never noticed what they were doing was wrong. Right. Not at all. Like, they handcuffed him. They're worried about him fleeing. And I'm like, but you have his car. And there's 3 police officers around him. And how is he going to fight 3 officers? He's a child. It's racial bias at its best. They just viewed him as bigger, as aggressive, and as more delinquent, and he was none of those things. So it's a good example of racial bias doing its role, unfortunately.
Absolutely. Thank you so much, Juan, because you actually introduced some of the research that we've told previously, the empirical research on implicit racial bias. This officer perceives him as dangerous, threatening, older, bigger, heavier, his facial expressions and his comments. And in fact, you all, as a practice point, we're trying to interject practice points for the lawyers and the advocates and the policymakers who are on these Zooms. His name is Tayon Leah, and Tayon and his family actually sued the police department and the police officer for this. And that's, taking this on. And they talk about how, look, really, the judge is fabulous. The judge says that Leah is acting far more confused, exasperated, and annoyed than he is threatening or even nervous, right? Like, this isn't a situation, where he's Tayon is reacting violently or aggressively even. He's just confused, exasperated. He actually seems to know at least somewhat what his rights are, right? And is asserting himself. And so fortunately, they won that suit, and it was found that, the officer had no basis to pull him out of that car and to treat him the way he did. And so, Tiffani, before we move on, did you want to add any just sort of, quick reflection on that?
Well, Juan said, the officers had no idea what they were doing. I actually do think they had an idea what they were doing. It's just my conjecture is that they were attempting to get him riled up so that they would have a reason to do something else. So it seemed like they were gaslighting him, and it seemed, very intentional. And it is hard to watch. And I just have so much compassion and respect for how he handled that situation, because he could have, got riled up and yelled. And so this is why we need to have these discussions, though, with our youth, to kind of teach them how to, even when you're in a situation that you don't deserve to be in, how you can maintain that composure so that you can get home safely at the end of the day.
That's right. That is a part of that talk. You know, we talked about why is it that parents have to do it so that you can manage, you can navigate. And I think, thank you, Tiffani, for that. I mean, notice, I mean, he calls his mom, or he's already on the phone with his mom. He wants to keep her on the phone. He's narrating, you know, the encounter, right? And his exasperation is like, look, he asserts his pride in himself. You talked about, you know, we talked about Black pride. He's like, look, I am graduating, right? I have never done anything, you know, and so it's a powerful example of what we can, you know, to the best of our ability to teach our children. But let's be clear, we do not believe that the burden should fall on the kids, right? To have to answer and to have to be calm, that we have to have systemic and policy reform, you know, throughout, so that young Black and brown children don't experience this.
Thank you so much for lifting that up. I think we talked about this in our call before, was that I do think resilience is important. I do think preparing youth for these encounters is important, but I sometimes get frustrated when the strategies focus on how to buffer us against racism instead of how do we make the system less racist. So just thank you for lifting that up. And I'm glad to have, you know, colleagues who are working in the justice system, and we're thinking about what are our policy changes, what are our practice changes, so that youth don't have to experience this, instead of just preparing them for how to deal with it when it happens.
That's right. That's absolutely right. So, Tiffani, let me ask you. So this is an example of a young Black male teenager, right? And so many of the examples that we see on the internet and we hear about in the news involve Black males and other, you know, males of different ethnic groups, but I want to focus for a second on girls, right? You write about the unique ways in which Black girls experience policing, both in the community and in school. You know, can you say a word about that, how it's similar, how it's unique, and helping us understand the trauma that Black girls and other girls of color experience?
Absolutely. Thank you so much for lifting that up. I think that, you know, a lot of the more publicized cases of police shootings and police interactions in the community setting have involved Black males, but we can't forget that there also have been cases, highly publicized cases of Black girls who also die at the hands of police, whether it's during a wellness check or during a stop, a vehicle stop by law enforcement. But particularly when it comes to the education system, and policing in schools, we certainly see a great deal of bias and police contact there. And a lot of it is related to Black girls not conforming to the stereotypical roles that young girls are expected to conform to, and then their behaviors then become inappropriately criminalized. And so I kind of mentioned earlier that there have been lots of videos highlighting where you have a Black girl, a young Black teenage girl with a big old law enforcement officer in their school literally flipping their desk over when they don't want to stand up in the classroom. There's another video in the Chicago public school system with a teenage girl who's literally dragged down the stairs after not resisting, not fighting, not provoking. And so I think that that's an important point as we think about, like, we have to prepare our youth for it. Is not just our young boys of color, but it's our young girls of color that are also experiencing this. And so thank you for making sure that we're giving voices to those experiences that they're having as well.
Yeah, and to really highlight that point, we actually have one like literally less than 2-minute video to draw that out. I mean, you're talking about Shakira Murphy from South Carolina, flipped out of her chair, the young girl from Chicago dragged down the steps. And then there's another girl from Florida.
The kindergarten girl, like a young child who, you know, is having a tantrum, and they call the police and literally put her in handcuffs, and she's like begging and pleading and fearful of what is going to happen to her.
Yeah.
It is, and for me as a pediatrician, right, it's just sad to think of, if you have these experiences in preschool, kindergarten, elementary school, middle school, right, how do those experiences, not only those negative like physical and emotional effects that they have on your health and well-being, but how does it also impact your relationship with the education system? And how does that also impact your life course and your trajectory when you have these negative experiences in school that that make you not want to go to school and not want to learn, and it prevents our children from just achieving their highest level of well-being?
Yes. So we're going to tee up that one video, the one that you're talking about. Kaya Roll, if I'm pronouncing her name correctly, is the 6-year-old girl who was arrested, as you talked about, in school for having a temper tantrum. And Amy will cue that up. And I really want to say something about anecdotal. We show videos to bring these moments to life so that we're not just talking about data, but you better be clear, the data is there. Black girls are 3.6 times more likely to be arrested at school than a white girl, right? So the data is there to support it. Empirical research also supports and accompanies the anecdotal data, demonstrating, as Juan talked about, implicit racial bias, that Black girls, for example, are perceived to be older, more mature, less innocent. Empirical research shows that Black children, even young Black children, are perceived to be angry in school when in fact they're really just sad in school. So let's just show that quick video to really drive this home.
Come on, let's go.
Okay, come on. You don't want to?
No, please.
You have to.
No, please. Give me a second chance.
You gotta go.
Please, please, please. Please, please let me go. No, don't help me.
Okay.
Please.
So again, just how incredibly, powerful and painful a moment like that is, just on all the levels that we just talked about. Racial bias, the ways in which we would never, I'll just make the statement for myself, we just are very unlikely to respond to a white child in the same way for quote unquote acting out, right? Without trying to figure out what's underneath it. As her grandmother said, she had sleep apnea. Instead, we go to criminalizing health-related issues. And as Dallas said, that intersection between disability and race, right? And that we see that Black and brown children with disabilities have an even higher rate of arrests in school and in the community. So all of this is profound, and we really just want to make sure we keep children's real experiences alive and not just the data. But so let's turn back though to that empirical research, and particularly to this psychological literature about the impacts, the traumatic impacts of policing on Black and brown youth. And so I want to start with Juan again. And, you know, we're watching this video, and I also want to give nod to the fact that Kaya's grandmother and Kaya made the decision at the time of this incident to make it public, including her name, so that people could learn and grow, and so that we could have policy change as a result of this incident. Right. And in fact, there was in that state. And that's another policy or practice point that I want us to make sure we take away from this conversation. But so, you know, on the research one, you know, it's impossible, right, to prevent young people today from watching videos like the one that we just saw. Right. We saw it intentionally, but young people on their social media, watching television, run across these vivid images, right? These vivid encounters. And listening, by the way, I was listening to Cops Shot the Kid, for those of you who were on at the beginning of this webinar, listening to the words, right, in which the Nas, you know, is talking about, and the other artists on Cop Shot the Kid are talking about this police encounter, this police officer, you know, this child running away from the police and getting shot in the back. It's in the music, it's on the news, it's on social media, and you can't prevent young people from seeing it. And so my question is, there's some really powerful research on the trauma associated just with watching it. You know, we haven't even gotten to experiencing it. What does the empirical research show about the impacts of watching and hearing about and listening to music like that?
Yeah, many of this research shows that there are harmful consequences among youth. And recent research by an actual colleague and former mentor of mine, Dr. Tiffani J at the University of Southern California, she performed a study among Black and Latinx youth. And what she found is that 45% of teenagers are reporting being constantly online. And online has a lot of these viral videos going around. And what these videos can have is that they can in turn be problematic, as watching these videos are associated with greater depressive symptoms, as well as greater post-traumatic stress disorder symptoms. So they're not only reminding of traumatic experiences of in-person experiences, but they're also being exposed to these experiences in online settings. And there's kind of just one thing I kind of want to add about why it's important to think about these viral videos. Like, I'm glad in the video that we just saw that there was permission given by people in the video, but other times there's not permission given. And so, you know, I want to think about what are things that we could do to help monitor some of these viral videos, because if it were a white kid doing it, there would be a warning message at the beginning saying, beware. There will be a warning. There'll be a lot more blurring for sure. So I wondered to what degree we could have some of those practices that are there for other of these viral videos.
Oh, I love that. I mean, you inserted a really good policy practice point. There's been a lot of conversations and, you know, webinars about how, how do we navigate this world in which everything is available, with the video, and the videos have been helpful. I mean, I think, the outrage of our country after the killing of George Floyd is owed to the young girl who videotaped that and shared that. But at the same time, the other side of that coin is the trauma and the triggering and the lack of permission and the pain to the families to have these images out. So I think it's a very powerful point that we won't resolve today for sure, but it's so incredibly important. But your point, I love that Dr. Tynes, or Vendisha Tynes, and for everyone who's listening, we've put the study in the chat. Her work is fascinating around this question, and it follows from her work on the impact of watching these viral videos follows after the research that was done after the collapse of the Twin Towers and after the collapse or after people were stranded on bridges in after Hurricane Katrina and after the Boston Marathon bombing, the ways in which people, adults, were watching those incidents, those events, and suffering from post-traumatic stress disorder. And what Brendisha Tynes and her colleagues do is they say, let's look at this among adolescents looking at police brutality. And so thank you for summarizing that. It's really, really powerful to think about that, and that the empirical research plays it out. And
Can
so
I just add to that, you know, like what you're talking about is it's the vicarious experience of police trauma. So there's both the direct experience, but also vicariously through what you watch and what you hear about. And the literature shows that it impacts academic outcomes, it impacts mental health outcomes, as well as physical outcomes. So some of the examples are vicarious trauma of police shootings in communities of color has been associated with lower high school completion rates, lower grade point average, as well as lower rates of college enrollment. So when we think about the Black-white education gap, some of these vicarious experiences of police trauma are contributing to those. Also, lots of negative mental health outcomes with, you know, depression, even suicidality and suicide attempts, increased rates of coming to the emergency department with youth reporting their fear for their life after watching some of these encounters. And they're also associated with physical health outcomes, including higher rates of diabetes, high blood pressure, and even asthma episodes from some of these experiences. So it's really important that we highlight both the direct as well as the vicarious and the negative outcomes we have.
Absolutely. And you used to talk about direct outcomes, vicarious outcomes. And then we often in our justice space use the word the collateral effects, right? Those cumulative long-term collateral impacts of these experiences. And I actually, you brought up school, and I was going to ask Juan about it later, but this is a perfect time to ask you about it. It's Juan, you've written about that, right? You've written about how these encounters have a collateral impact specifically on schools. Can you say a bit about that?
Yeah, you know, if we think about some of the ways that law enforcement looks like or mirrors some school practices. So in both institutions, governmental institutions, they're both are comprised of figures with power and who are predominantly white and engage in similar harsh disciplinary practices. You know, in school is much more in terms of suspensions and expulsions for many minor misbehaviors, and the same thing with law enforcement, being stopped and frisked for a very minor or even absent of an infraction. And so when kids are experiencing these things on the street, on their way to and from school, or even in school, it can help shape some of those, like it could shape their perceptions of how to view schools. You know, I'm being treated this way from law enforcement, and I might experience this the same way from teachers, or even teachers are contributing to that. So we do see in research and various studies that youth who are stopped by the police in school report lower engagement, such as liking towards school, participation in school activities, and other forms of engagement, and even poor school grades overall.
Yeah, there's, you know, quite a bit, your research, and then Daniel Lowson, for people who are interested. And as you all know, for those of you who are new to the webinar, at the end of these webinars, we compile the research for you and we send it out as an email handout for everybody who has registered. So we will definitely, you know, be sure to add some of that. And this idea that both you, Tiffani, and Juan are talking about this vicarious, you know, trauma and the collateral trauma or collateral consequences. I think about when young people, adolescents, distrust police officers, that distrust of police officers transfers over to other authority figures like teachers, like counselors. And we've seen that in some of the other research, and we saw that in the school to prison webinar we did not too long ago that you can find online. It's really powerful. I also anecdotally think about many of my clients, right, who get arrested at school, talk about how much more humiliating and embarrassing it is to be arrested in school in front of your classmates and your and the like. I think is really important. And so I want to definitely ask Joe if this resonates with him. But before I do that, one other piece of your research, Juan, that was really powerful to me on this very point that Tiffani raises about vicarious trauma is that there is empirical research showing that if you are physically present and watching, let's say, a friend, a family member, someone that you know being stopped and frisked, that also can be as traumatic or similarly traumatic as being frisked yourself. Can you say a bit about that?
Absolutely. So in one national data set, what we found is that if you take the kids who were stopped by the police directly, if you take them out of the sample, what are the experiences of youth who have not had any direct experience, but have had witnessed a stop by the police towards a family member, a friend, an unfamiliar stranger. And what we find is that those perceptions witnessing those stops are associated with greater emotional distress, greater post-traumatic stress disorder symptoms, and even poor school outcomes that we mentioned earlier on. So even though we know that these direct experiences are very harmful, even just witnessing them has similar detrimental effects.
It's pretty wild to think about, right? And if you live in, you talked earlier about surveillance, living in a heavily surveilled neighborhood. So that means someone who grows up in a heavily surveilled neighborhood and in a heavily surveilled school is far more likely to have one of these moments of observing. And as you talk about, Tiffani, the girl being dragged down the stairs at the Chicago school, I mean, first of all, everybody heard about that, right? And so I often say in these conversations that every negative encounter that a teenager has, you better believe that teenager goes and tells somebody else, their friends, their family, right? And so, I'm willing to guess that all those kids in Chicago went and looked for that video online, and we could find it, and it's there, right? Joe, so I do want to turn back to you and ask you, like, this conversation that we're having about sort of vicarious trauma, this observing it either online, observing it, in music, watching a classmate being arrested in school or frisked, does that resonate with you as being equally harmful? And have you talked to other young people in the community who have been impacted by watching, for example, George Floyd killed or or young people killed?
Absolutely. I definitely can touch on all that, especially with the music platforms. I spoke on some of my social media platforms literally last week about the music, how, it's really like disruptive. The music industry need a whole new reform in regards to the music, but it's just about what we see, what I'm saying, the experiences, what we go through. But yes, absolutely. And a school experience by police officers being in school. Like, I go to Southeast, like a heavy, like what they used to call it back in the day, Big Bad Baloo, like one of the most, scariest schools in DC. And we had a lot of police officers there, and some of the officers was cool. Like, some of the officers was cool, but you still got that fear of like, wow, I might go to jail, or if they call you like, hey, come here, let me check you real quick. But it was times I got arrested inside the school cafeteria, and it was just so like dehumanized. Like, I felt so embarrassed. Like, I put my hands down and they put me in a room, and it felt bad. Like, in the cafeteria, that's where all, like, a lot of the popular people be and stuff like that. So you just get arrested in the cafeteria because you got in another fight with another kid. It was just, it's embarrassing. But where the George Floyd situation, it definitely was powerful. It definitely was it was unfortunate that he lost his life, but it was a powerful moment, of course, in the history of what's going on, police brutality and things like that. And seeing that, I don't know how many times I watched the video, and that's trauma, and it's sickening that I'm so immune to watching these type of things. Like Tiffani brought up about the vicarious trauma. Like, I'm so used to just watching so many traumatic things that's not natural. And so just watching that George Floyd things was just, it was crazy. You know what I'm saying? I'm just so glad that was captured, unfortunately, for we could just bring justice to it.
But thank you for bringing that point up, Joe, around how a lot of people, so some people become like hypervigilant and have anxiety and depression related to it, but then there are other youth who can become numb to it. And so what are the consequences of becoming numb to this violence and numb to this trauma to the point where you think, well, I'm not going to live to see 21 or live to see 30 because of these things, and how that then gets internalized and impacts risk-taking behaviors because you don't see a value for your own life because you just become so numb to this violence that we see. So that's another kind of side to the coin as well.
Absolutely. Thank you, Tiffani, for that, because I also was going to lift that up because that's in Brendisha Tynes' research. She talks about the continuum, the spread that Tiffani just talked about. On one end, hyper-aroused, hyper-vigilant, and on the exact opposite end, you are, numb. And I got to tell you all, if you all go watch Nas's video, Cop Shot the Kid, in that video, you see the kids are literally just frozen. They're paralyzed watching this, repetition. Cop shot the kid, cop shot the kid. And it's meant to, in many ways, to visualize exactly what you're talking about, Tiffani, that just absolute numbness as they sit there in front of a television screen watching this. So very, very powerful point. I also wanted to sort of highlight this notion of how embarrassing and dehumanizing to be ushered out of the cafeteria in front of the cool kids. And I have to tell you, I talked about Kevin, my client. He tells me out of all of his encounters, like the 50 encounters that he had with the police, the one that made him the angriest was one day standing in a group of about 25 kids, minding his own business. They're all chilling, doing their own thing. Literally, the jump outs, the police officers in DC call them the jump outs, fly up, run to the middle of that crowd of 21 kids and pull him out and arrest him. And he wasn't doing anything, at all. And, actually, I think that day, he may have had weed, but his point was, so you're going to come get me for some weed? Right here, you know where I live, you know where I go to school, you know where I go to the convenience store, but you had to wait and do that in front of 21, 23 of my friends. And that to him just infuriated him. So it's a really, really powerful point. The other thing I will say about, this notion, you said, Joe, and I could hear it in your voice. So you arrested me at school for fighting with another kid. Normal adolescent behaviors, right? Normal adolescent behaviors. Why is it that we need police intervention on a school fight, right? And so I just think all of that is so powerful. And then the final thing I'll just say about music is that, honestly, I have, sort of almost mad respect for artists who speak about these issues, one as a way of healing, right? How I'm going to talk about, this is my outlet to process how I perceive racial injustice, police violence, right? So of course, it has some harmful effects, but think about, in thinking about how this music comes about, it is an expression. It is an articulation of everything that we've been talking about on these videos. I mean, on this webinar today. So I want to, turn back to you, Juan, just to say a word about really, and we may have touched on it, but I know that this is covered or addressed, in your research, this notion of policing as perceived as a form of racism. It certainly ties back to what Tiffani talked about, earlier, right, with your ACEs and the structural racism. But there's research specifically talking about not only policing as trauma, but policing as a form of racism, whether it's real or perceived. And so I just want folks to know that there's research out there on that. What would you offer to support that?
Yeah, it's all embedded in the context, in the United States, where policing came from, where it stemmed from back into the era of Jim Crow. And, I'm not sure if you want me to get at some of the short and long-term effects of some of these policing practices, even though they're not maybe explicitly racist, but we know they're inherently racist when they're specifically targeting certain groups. But, right now we kind of spoke a little bit about some of the individual level consequences of some of these experiences. And, we talked a little bit about epigenetics, but there's a lot of also intergenerational effects of policing because of how in the communities that are highly surveilled where there's this increased likelihood of having an arrest record on your record that can limit some of your job opportunities and even have limited opportunities for upward social mobility, that can concentrate poverty in a specific racial group. And that just affects like that racial group's opportunities to succeed in that community. So there's some of those, intergenerational effects, but, also there's the long-term effect on even on the United States. I think as Americans, we constantly think about how other nations who struggle with corruption with law enforcement, but I'm like, we have this back in our backyard. So this is going on here in the United States. So this kind of has detrimental consequences on some of our ideals as democratic, equitable societies, that if this were to persist, it detrimentalizes it.
I'll just add to that it even predates the Jim Crow, right? So the earliest police forces in the United States were the slave patrols. And so I think that historic context is really important because, policing, their purpose was to maintain a social order that preserve structures of racism and uphold white supremacy, anti-immigration ordinances. And so it's sometimes frustrating when these encounters are labeled as like just a few bad apples, when really it's like a manifestation of a system doing exactly what it was designed to do, to uphold white supremacy. And I think that it's important, particularly when there are, discussions over the past couple of years around defunding the police and abolishing the police, and thinking about how do we reimagine a system just given that the foundations of policing in the United States.
Yeah. And that is so true. The historical arcs on all of this, the historical arc, on, policing at its foundation as slave traders, and policing, the evolution of policing in schools as being very much tied to the fight for civil rights. And so we're going to send police in schools not to ensure a healthy integration or a safe integration of Black and brown students into the school system, but to be an impediment, right, to full integration of schools. So all of it has got that historical arc. So I really appreciate that. Let me stick with you, Tiffani, on this question of policing as racism. I often talk about how racial discrimination is intersecting and cumulative with the racism Black youth experience in other places in their lives. And so, Tiffani, I know you have written about this, and as a pediatrician, I'm sure you've seen this in your own work as well, but I'm interested in how racism in healthcare exacerbates or intersects with racism that young people experience in policing. Right.
Listen, we can talk about this for another 90 minutes. So how can I keep this to 90 seconds? So I'll say first is that, I think especially when, around the murder of Ahmaud Arbery, George Floyd, and Breonna Taylor, when there was this kind of racial reckoning, you saw a lot of healthcare providers with white coats for Black lives taking a knee. And my frustration with that is that it's very easy for healthcare providers to look at a video of a police officer with his knee on the neck of a Black man and say, yes, that's racism, and yes, that's wrong. It has been a lot harder for healthcare to look at the ways in which we have put our knees on the necks of our patients, and the ways in which we're causing harm. And a lot of that was brought up with COVID related to vaccine and the vaccination hesitancy within the Black communities, and why don't they trust us? And that mistrust is very well earned mistrust. And it's not just Tuskegee, and it's not just the history of racism in medicine, but it's also a modern context in modern day, and with the disparities that we see in the healthcare and health outcomes of children, adolescents, adults across the entire spectrum and across the entire life course. So examples, the maternal and infant mortality rates in the United States rival third world nations. And there's data that shows that some racial concordance, so that when Black infants are taken care of by Black physicians, they have lower mortality rates, and the mortality rates are 3 or 4 times as high when they're taken care of by white physicians. If the opposite were true, And if white infants had higher mortality rates when they were cared for by Black doctors wouldn't be allowed to practice medicine in this country, and they wouldn't be allowed to take care of white kids. And so the fact that there aren't outcries about that, there's data that shows that the mortality rates after surgery are 3.5 times higher for certain surgeries for Black children in comparison to white children, even when they don't have any baseline other premorbid conditions that contribute to that. There's a robust body of literature looking at disparities in pain management in the emergency department, where we don't believe Black pain and we assume that they're drug seeking and don't appropriately treat their pain or evaluate them for conditions when they come. So there are just so many examples of the way in which we cause harm in the healthcare system that I think that, we need to make sure that we're turning that lens on ourselves and recognizing that, yes, we need to speak up against injustice that exists in the communities. And we also need to get our house in order and address those injustices. I think the other piece of this is thinking about the intersection of law enforcement and healthcare. And so there is literature that shows that if you that visitors and family members who are visiting the hospital are significantly more likely to have hospital police or security called on them than white families are. There's one, I can put in a link for an article where I talk about this, but there's one example of a father whose daughter was, and again, there's the empirical evidence of, of lots of robust literature, but just a story to kind of take this home is a father who was being told that his daughter died. So she was hit by a car and she died, and the physicians were kind of telling the dad that she was dead. And a pastor is observing this, but there's a pastor in the room, the healthcare team, as well as a social worker. And then the pastor describes the father as just saying like, no, like just distraught, but not yelling, not throwing things, not being violent. And then the social worker says, if you don't calm down, I'm going to have to call security on you. So we're not even allowed to express grief. There's another example to kind of take that home is a mother whose child was diagnosed with cancer, and she reports kind of sitting there holding her baby in the hospital and crying, and the nurses came in and didn't acknowledge her pain, didn't acknowledge her administer the medications. And then the next morning, social work comes to her and says that you're standing in the way, the nurses are afraid of you and they feel uncomfortable. And so the ways in which we express grief during very challenging moments, and that becomes criminalized within the healthcare system, again, as I'm making a call for how do we reimagine policing in the community and the role of policing, we also need to reimagine that in the hospital, right? And how do we create environments where we can make our patients and our families feel safe and not cause more harm because of the excessive presence of policing, whether it's the hospital security police or whether it's external law enforcement that has just been giving unfettered access into our system. So again, I can talk about that for forever, but I'm sure you have some other topics that you want to get to as well, Chris. Oh, you're on mute. You're on mute, Chris.
Sorry, thank you. I was making noises while you talked out of excitement. I had to put myself on mute because, that so resonates with me. Thank you. So, there's so many things that I want to say in response. One, just briefly, Tamir Rice's sister, right? When he was lying there after having been shot, she runs to him and the police grab her, right? It's the ways in which police interfere with like families who are grieving. Tamir Rice's mother wanted to hold his hand while he was lying on the gurney at the hospital. And they told him no, and they told her no. So, that part really resonated with me. The other pieces that resonated, particularly as a defense attorney, right? And as I think about practice points, practice tips for the advocates who are on the call, I love how you talk about the intersection of law enforcement in these medical spaces, right? The ways in which we have given police unfettered access, to emergency rooms, particularly emergency rooms where Black and brown folks are vulnerable, who go, for care and support. And so there's a burgeoning conversation around that, right? Around whether or not the Fourth Amendment rights, the right to be free from unreasonable searches and seizures, should be extended to the hospital. And the way, it plays out in practice is that a police officer is called. Why? Because some medical personnel acting on implicit bias that, like Juan talked about, that if I've been shot, I must somehow be involved in that shooting. I must somehow be at fault or, responsible for my own victimization. And so police are called into those spaces and interrogate, victims, right? People who've been hurt and who've been injured and who seek shelter. And so there's a growing body of research. I lift up the work of Jisun Song, particularly because she's a longtime youth advocate, youth defender, and a former leader of, the Pacific Youth Defender Center. And she wrote about this, policing in the emergency room in the Harvard Law Review. And I'll let my colleagues put that in the chat. But she raises, a number of issues about the evidentiary admissibility of statements. I just can't tell you. You're exactly right, Tiffany. We could talk about this for 9 months, but we will not. We will move on. There's so many other things to raise. I want to make one point. I would love Juan to address this point, because it's a question that we get often, which is this idea that so many of the Black and brown children that we are talking about in this webinar and that we work with on this in this Zoom is that they already come from communities that suffer from high rates of trauma, stress, poverty, social isolation, underemployment, victimization. And so that when we talk about police violence, right, or we talk about policing as trauma, folks want to know, well, isn't it true that this is just part and parcel, of all of that, and that the impact of policing isn't independently isn't an independent variable in their trauma, because they already have these pre-existing conditions and experiences. So I'd love for Juan to help us sort of understand that, push back on that narrative, to be quite frank.
Yeah, one nice strength about longitudinal studies is that you can help account for a lot of that, a lot of those confounds. Basically, things are confounded with policing, such as crime, such as other adverse experiences. But when you follow kids over time, you get to control for that, a lot of those confounds. When kids are reporting deviations relative to their own average on like a mental health outcome, or who are stopped more often than normal, you could to then pinpoint, is it that stop that's predicting some of those negative adverse outcomes? So that's one way to go about it, and we find evidence to support that it is a policing that is more predictive of these outcomes than it is other adverse experiences. And another nice method is when you look at siblings, what happens to one sibling that experiences police intrusive encounters relative to the other sibling? They're growing up in the same neighborhood, the same socioeconomic status, so you can help account for some of those confounds and specifically pinpoint, is it the policing or is it the other adversities? And even in those methods and those designs, you still find that the sibling that reports more police intrusion still shows worse negative outcomes relative to the other sibling reporting less intrusion.
I so love that answer. It's so important, when those of us on this call are testifying before city council or, trying to make folks understand this. We can't just write this off, as part and parcel of the neighborhood. I love that we are able to tease this out. And so the last question I want to ask about this intersectionality, I want to ask of Joe, which is this notion of the ways in which various forms of discrimination sort of compound, as you will, on one another. And so I want to ask you, Joe, how do you see racial discrimination in policing intersecting with racial discrimination in other parts of life, that affect Black children? And so I'm thinking in particular about you and your work with WeFit, right? And you work at parks and recreations, and, what are the ways in which, access to those spaces, is impacted by policing and is perceived or feels like a moment of racial discrimination?
Absolutely. So back in 2020, actually founded in 2019, but in 2020, I started a big movement, We Fit DC, big wellness movement in the city, where I'm going around in these underserved areas. And we had a issue with DPR because we didn't have really permits. And I'm like, I understand the logistics and stuff like that, understanding business, but I'm like, we're doing free things. It's a pandemic going on. It's a heavily impacted area. People suffer from diabetes, high blood pressure and they dying by numbers over here. We got the highest numbers over here with people of color. So I'm really trying to provide them wellness services. I'm partnering with organizations providing fruit. We doing fitness services, and we're actually taking people temperatures out there. We're making sure people match not just 6 feet. We're doing like 8 to 10 feet, and we out in space. But you know, DPR, so they send when they know I'm doing, because my events was so big going on in the city, they send the police there. And one event we did, we had about 12 vans, police vans came out to one of our events and try to shut our event down. And fortunately, the council member was there, and, you know, he shut it down and was like, this is crazy what you're doing. This is like racist. Like, y'all not doing that uptown on the other side of the city with the other, like, you know, things going on. So it been a lot of encounters with that. And I was like, why are we doing something that's so impactful and powerful for our community? And they want to shut this down. We only out here for an hour and a half. So that's one big one right there. They literally came out there in like 12 to 15 police vans ready to lock people up if we didn't leave. So it was crazy.
12 to 15 police vans, right? To shut down something that is doing good for the people in a pandemic. It's really powerful to understand how that's perceived. And just as you talked about it, your perception is they're not doing that uptown. Right? You're only doing that down here. So really, really important point. I want to pause here and re-engage with the audience just for a moment here. So we've talked about a lot of research. And again, I promise you, we will get that research out to you, via email for everyone who's registered for this webinar. But we want to ask about how lawyers, how advocates, how policymakers, school officials, the health field can use this research, right? And so I want to ask the audience, just simply, first of all, a yes or no question, whether or not you have attended one of our trainings over the last 2 years on policing as trauma. This is more of a webinar, an educational webinar, but we have also been doing literally trainings on how to litigate policing as trauma, how to use it in arguments. So you'll see on the screen, yes or no. How many of you have ever attended a policing as trauma training hosted by the Galt Center and the Georgetown Juvenile Justice Clinic? And I should note that the Galt Center formerly was called the National Juvenile Defender Center. So please answer. We're letting the answers come in. And then the second question, you probably saw that. If you haven't already, would you like to? And there's a lot of yeses. So we're contemplating whether to reinitiate that series. And it sounds like there would be some interest, right, among you. So about 40% of you have joined one of our trainings specifically on this, and about 60% have not. There's about 90% of you who would like to make these available. We will convene as a team and figure out what we could offer and get that back out to you. The next question that we want to ask is a larger poll. And this requires us to think about how we can use this research in our litigation. So I'm going to tell you now, we're going to do 2 polls, one of which is largely going to be for litigators, for lawyers on the call. The next one that I'm going to do will be largely for policymakers or any others who are not litigating in court. The first question is, have you used any of this research on the traumatic effects of policing in your litigation strategy as a defense lawyer or a trial lawyer? Maybe you're an education lawyer. Maybe you're a youth defense lawyer. So I want you to check off all that apply. Have you used the research on the traumatic effects of policing in your detention arguments, your shackling arguments, in your Fourth Amendment motions, your challenges to statements, some trial theory like self-defense, arguing, for example, that it is wholly reasonable for a Black child to be afraid of excessive force by the police? Have you used this research in disposition? Have you used this research in conditions of confinement? And I'm thinking here about Khalif Browder. And even though, it's not a police officer in a blue uniform, It's a correctional officer in a detention facility for 3 years who, is, Khalif Browder experienced that as violent, as psychologically aggressive. And so you see the poll there. Please fill that out. We'll see what we get. All right, and came back. So what we see is some people are using this research. Some people have used it as a trial theory. Some folks, that seems to be the highest category. Second highest category appears to be disposition, right? So providing context. And I think this research that, Tiffani talks about as a pediatrician, and the health impacts, the collateral physical health impacts. What are we doing to exacerbate that when we put children in detention and incarceration facilities, right? We're exacerbating those long-term health consequences, right? Great. Fourth Amendment detention arguments, very good. So we're going to do the same thing on policy. So what I want to ask you all, we're going to do another poll. We'll pop that one up. How many of you have used this research or similar research in policy advocacy, police-free schools campaigns, for example, decriminalizing certain offenses like disturbing schools, prohibiting stops based on the smell of marijuana, which we did in DC, arguing that there should be no interrogation of no police interrogation of a child without a lawyer present, anti-racial profiling legislation. Have any of you used this research that we've been talking about today in any of your policy advocacy? And then we'll get those results. All right. So yes, some of you have been using it in police-free schools and all of the categories that we listed here. And for those of you who put other in this one, or in the previous request, can you please put in the chat how you use this research? We really want to share these ideas so that we can all be using them. And then a number of you have said that you've never used this research in policy. I really hope you will after this webinar. And so what I want to, we're about to wrap up here. I want to turn to Tiffani and Juan and Joe to ask you all if you have other ideas. And Tiffani, you've sort of thrown some out, right? Like, thinking about how to reform, hospitals, but generally, and you don't have to, the three of you don't have to answer this, but if you have any other, policy ideas or litigation strategies that we could be using this research, I'd love to hear you just share them with the audience.
Yeah, one of the ones that come to mind immediately, because I work a lot with schools, is that right now, critical race theory and other opportunities for youth to learn about historical figures and how those historical figures overcame or contributed to the struggle for racial equality and overcome obstacles. A lot of those messages are being much more limiting now, and we need to tackle against those practices. We need those messages. We need diverse curriculum. So I feel like having that curriculum is essential in order to contribute to this struggle. So that's another
I really love that. The tying in of critical race theory as a buffer, as Tiffani talked about, it's a buffer, that race pride as a buffer to, right, the traumatic effects of policing and other moments of discrimination is really important.
I'll say that I think that suspensions and expulsions for preschool children and kindergartners should be eliminated. I think it's ridiculous to expel 4 and 5-year-olds from school as one. Other policy things that I kind of focus on as a pediatrician: how do we increase community investments in social determinants of health? So increase investment in education, housing, equitable economic development, and youth recreation, as well as mental health and public health. But that is going to require reimagining state budgets, which may potentially require reallocating some money that goes to armed forces towards some of these other social services that are going to be important. Another big issue that I see, especially like in states like California, where marijuana has been decriminalized, but still not for younger individuals, but we still see a lot of disparities in youth arrests for marijuana. And so I think that is a big area that needs to be addressed as well.
I love all of those ideas, and your first suggestion about, you know, the reallocation of resources, adopting a public health strategy for
Right.
school safety and for.
But what that requires is we have to redefine safety, right?
That's
Because
right.
I think a lot of times when people think safety, they need more police officers and more law enforcement, and that's not what makes you feel safe, and it's not what makes you safe, definitely. So how do we redefine safety and invest in those things that actually keep our youth safe?
Absolutely. And I think the public health framework helps us doing that, understanding a trauma responsive or trauma informed strategies, continuum of mental health, smaller class sizes. I love all of that. Very good. And Joe, you were going to add to that.
Yeah, absolutely. And it's funny that Tiffani brought up the suspension, because remember when we was on the panel a few weeks ago, we brought that up. We spoke about that. But I would just say the well-being portion in regards to like stop sending police officers to households that people that got mental issues. You never know. Send somebody in there that can like a wellness professional that can actually de-escalate the situation and can relate to them, instead of sending an officer that don't have no experience and end up killing somebody that had this mental background.
Huge, right? And that actually what takes me somewhere else, just listening to you, Joe, talk. I say this often, if you want to know how to make the world a better place, ask the young people. If you want to make the world a better place for young people, ask them, is the way, I like to say it. You know what? Sit down, create space for young people, right? To have these conversations, to share their trauma. And I think I've heard that reflected in all three of your comments, this idea that young people experience these moments as racialized, as discriminatory, as exclusive, as traumatic. Where do we create space for young people to talk about that without making them, without blaming them for these moments? And so I really, really, really have loved this conversation. We truly could talk all night. And I agree with Ebony saying, Tiffani, Dr. Johnson, Surgeon General next, Joe, Mr. WeFit, we so appreciate all the work that you have done and are still doing despite the odds of getting stopped, by the police, out in parks and public spaces, that you keep pressing, not just for the physical health, but also for the mental health of young people. Juan, thank you for your research. I cannot tell you how many times I've cited your research in legal pleadings, in my book, in legislative advocacy, all of it. All three of you are doing phenomenal work. As Mary Ann said at the start, I see all three of you fully pulled into our community after this webinar. Expect a call from all of us to testify at various points.
Absolutely. And Chris, can I just give a quick shout out? I want to give a quick shout out to Free Minds Book Club. They was with me since I was 16 years old, and they deal with incarcerated youth that's incarcerated in like these adult systems, and they still deal with you as an adult, sending you books, writing. If you're an artist in regards to a rapper, a singer, actor, they just been blessing me. That's how I got connected to Chris. So just shout out to Free Minds here and there.
Absolutely. We love Free Minds, and Reba just dropped it in the chat. It is so true. Love it. The ways in which we use artistic expression, writing, music, art for healing, create opportunities for young people to do just that. So with that, we will conclude, and we will see you next month. Really, thank you to all three of you. You were fabulous.
Thank you so much, Kristin. It's nice meeting you all.
Thank you for having me. This was really wonderful.
Thank you.